Ready to decode your DNA for the perfect psych med? Think a cheek swab might finally explain why you get every side effect in the book or why meds barely touch your symptoms? Hi, it's Brain Bites with me, Dr. B. I'm Jessica Beachkofsky, your friendly online psychiatrist. And today, we're diving into the world of pharmacogenetic testing. What it is, what it can actually tell us, and whether it's worth doing. Let's dig in. Spoiler alert, pharmacogenetic testing is not magic, but it can be helpful, especially if you've been stuck in the guinea pig trial and error cycle for way too long. Let's start with what this testing actually looks at. Pharmacogenetic testing is all about how your genes influence the way your body processes medications. Not if a med will work, but how it moves through your system. These tests zoom in on enzymes in the cytochrome P450 system, mostly found in the liver. The VIPs here are CYP2D6 and CYP2C19. And these enzymes? They're like your liver's bartenders. Some are slow and careful, some are lightning fast, and some not so great at their jobs. Why does that matter? If your body breaks down a medication too slowly, you might get side effects fast. Too quickly, the med could fly through your system before it has a chance to help. You might hear results like poor metabolizer or slow clearance, which leads to more drug buildup and ultimately more side effects. Ultra-rapid metabolizers clear drugs super fast, which means they may not work as well at normal doses. So in theory, knowing your metabolizer status can help us choose or adjust meds more wisely. That's the dream, right? So what medications does this apply to? In psychiatry, we're talking about SSRIs and SNRIs like fluoxetine or venlafaxine, TCAs like nortriptyline, antipsychotics like aripiprazole or risperidone, some benzos, and a few mood stabilizers. Outside of psych, we're talking about pain meds like codeine and tramadol, beta blockers, proton pump inhibitors, clopidogrel, and some statins. So this isn't even just for mental health meds. It applies to lots of liver metabolized medications too. So why might someone really want this testing? Because let's face it, the trial and error process of figuring out just the right psych meds is rough. You might want this test if you've tried multiple meds and nothing's worked well. You've had strong side effects at low doses. Or you or a family member seem to be med sensitive. Or you're on a lot of meds and worried about interactions. In those situations, this testing can be a helpful extra puzzle piece, not a crystal ball, but maybe a flashlight in a very twisty tunnel. But it's not a magic answer. Pharmacogenetic testing only tells us about pharmacokinetics, how your body processes the medication. It doesn't say much about the pharmacodynamics, which is how the medication affects your brain. So no, it won't tell you this SSRI will cure your anxiety. It might say, you may metabolize this med more quickly than average, or you could have more side effects from this one. That's helpful, but not a guarantee of anything. And sometimes results just don't help. I've had patients feel worse after testing, not because the results were terrible, but because they were vague. They wanted a clean, clear answer and got color-coded ambiguity. So what does the APA say? As a psychiatrist and a member of the American Psychiatric Association, I take this seriously. Their most recent position is from 2018. They said, testing may be helpful in select cases, especially after multiple treatment failures or unusual side effects, but routine testing for everyone is not yet supported by the evidence. There's been no major update since, although they continue to follow the new research. And a lot of the studies showing benefit, funded by the companies selling the tests. So while it's not off limits, it's not standard of care for everyone either. Other limitations? First, most of the data we have comes from people of European ancestry. That's a big problem for accuracy in diverse populations. Second, it only helps with liver metabolized meds. Not all meds go through that system. And finally, it doesn't account for the rest of your picture: your hormones, gut health, stress, sleep, trauma, inflammation, and the list goes on. Your genes are just one part of the story. Also, let's talk privacy. In 2023, 23andMe, which houses genetic information but not specifically pharmacogenetic stuff, had a major breach. Nearly 7 million people. Ugh. Pharmacogenetic tests through clinical labs are usually safe, but still ask questions. Who has access to your data? Where is it stored? Can you delete it later? Your genes are personal. Treat them like sensitive information, because they are. Okay, so if you do decide to do the test, what's the process? First, a clinician has to order it. You'll provide a cheek swab sample, saliva, or sometimes a blood draw. Results usually take a few days to 2 weeks. And since your genes don't change, this is a one-time thing unless testing for new meds comes out. Common companies that I've seen results from are GeneSight and Genomind, but there are others. And what about cost? Well, these tests can run from $300 to $400 if you're paying cash. Medicare usually covers it, and some private insurances do too. And most of these companies have payment plans or financial aid. So is it worth it? Maybe. If you've had lots of failed trials, unusual side effects, or a complex med history, then yes, this test might offer you a helpful clue. But if you're expecting a diagnosis, a solution, or a perfect medication, you're likely to walk away disappointed. A lot of times, clinical judgment still wins. This testing is a tool, not a solution. But in the right hands for the right patient, it can help. I hope your brain is full of pharmacogenetic goodness, no cheek swab required. Be sure to grab more tasty tidbits at brainbiteswithdrb.com. Enjoy!